So, what is diabetes? Diabetes is the condition in which of the body does not properly process food for use as energy. Most of the food we eat is turned into glucose or sugar for our bodies to use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin to help glucose get into the cells of our bodies. So these are the signs of symptoms of diabetes. Increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones is the urine. Ketones are byproduct of the breakdown of muscles that and fat that happens when there is not enough available insulin. Fatigue, irritability, and blurred vision. So these are the medications of diabetes. Glimepiride, Amaryl, glimepiride, pioglitazone, Juta. Glimepiride, resiglitazone, Vanderbilt. Glyplazide, glucotrol, glyplazide, metformin, metagalip. Glyburide, diabeta, glinase, micronase, glyburide, metformin, glucovance. So, when should you start taking medicines for diabetes? When to start early institutions of treatment of diabetes at a time when the AIC is not involved, is associated with improved glycemic control over time and decreased long-term complications. So what is HIV? HIV stands for Human Immunodeficiency Virus. It harms your immune system by destroying CD4 cells. These are the types of white blood cells that fight infection. The loss of these cells makes it hard for your body to fight off infections and certain HIV-related cancers. So these are the signs and symptoms of HIV. Rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts or more than a week, sores of the mouth, anus, or genitals, pneumonia. So these are the medications of HIV. There are several different types of HIV or AIDS medicine. Some work by blocking or changing enzymes that HIV needs to make copies of itself. This prevents HIV from copying itself, which reduces the amount of HIV in the body. Several medicines do this. Nucleoside reverse transcriptase inhibitors and NRTIs block an enzyme called reverse transcriptase. Non-nucleoside reverse transcriptase inhibitors and NRTIs block an enzyme called change reverse transcriptase. Integrase inhibitors block an enzyme called integrase. Protease inhibitors PIS block an enzyme called protease. When do I need to start taking HIV or AIDS medicines? It is important to start taking HIV or AIDS medicines as soon as possible after your diagnosis, especially if you are pregnant, have AIDS, have certain HIV-related illness and infection, have an early HIV infection the first 6 months after infection with HIV.